The main focus of the organization twinning program is taking the emerging organization and an established organization and having this collaborative partnership.
It looks to balance inequities that we see in healthcare by bringing experience of others and sharing that in a sense of community wherever you are in the world, irrespective of geography.
And so it is a collaborative partnership lasting. The Hemophilia Treatment Center twins last 4 years, the Hemophilia Organization twins last 4 years, and the youth twinnings last 2 years.
The theme for our particular twinning program was multidisciplinary team working.
What was most immediately apparent was the contrast in access to factor between Ireland, where every child is on prophylaxis, to Al-Bashir, where access to factor is constrained. Everything in haemophilia seems to be based on factor, but the centre in Al-Bashir were doing such good work with limited access to factor that we were coming back and looking at our own patients and see, what else can we do as members of a multidisciplinary team for our practice.
We have almost the same challenges, but we have different strategies to approach the challenges and also to address the needs of the patients in our respective countries.
It's not running the organization from your country. It's not saying you should do this. It's literally meeting them where they're at.
For the very first time, we worked on our 5-year strategic plan, a very comprehensive strategic plan, which is a tool that we are using to send to different stakeholders, even to government, even to Ministry of Health, to have it integrated into the national strategic plan.
One of the aspects of twinning that people don't really understand when they first get into it, you can really accomplish a lot through Zoom. However, when you're there face to face, that is where the magic happens. You are meeting with health ministers. You are meeting with the doctors and the nurses on the ground that are taking care of the patients living with bleeding disorders.
We met a family with 2 brothers with haemophilia B who didn't appear to be responding to treatment. But because the laboratory scientists from Dublin had worked with the laboratory staff in the coagulation lab in Al-Bashir, and because the inhibitor assay was set up, we were able to determine that those 2 boys actually had inhibitors to factor IX. So we were able to discuss a plan for future treatment with the team in Al-Bashir.
I have been in Montana with a very small population. I was able to interact with their communities, the family, the parents, the mothers, the patients, and you would see them having a smile because they have treatment, they have care, they have caring parents. And this is the same thing we should do as in Uganda. When Brad came to Uganda, he visited the eastern region. That is one of the regions that practices circumcision. The family he visited, they had lost about 3 patients because they didn't know about this condition. The husband was not supportive, so she's basically a single mother. So when she sees someone coming from a developed country visiting her, I think it touches people's hearts that yes, we have not received support from the husband, but at least we have people who are caring for us, who are ready to support our programs.
At the end of the day, we're one people. We all have the same needs. We need access to treatment and care.
If we want treatment for all, every national member organisation, every centre has a role to play.
The longevity of this program is that it works.
I think it's made us as a team closer in terms of recognising the strengths that we have as an MDT. We see the benefits both for ourselves as an established partner and also for the emerging partner, and we want to try and give back to our community in any way that we can.
The lives of people has improved, greatly improved. Without this generous support from our partners, we cannot achieve a lot.
And I'd like to encourage everybody looking at this to consider a twinning opportunity in their region if that becomes available to them.
When this programme started in the mid-90s, it was difficult to get sustainable improvements in care. And it's difficult to do that without mass buy-in from the centres, from the key doctors, from the patient organisations around the world. What the twinning program did and does is to show people this is not the WFH's job, it's all of our job. So it mobilised the global community to get help and support and comradeship and collaboration globally to all of these countries.